Well, there are now fewer than 50 active cases of COVID-19 in the Thunder Bay district. It's the lowest case count in the area for months. However, variants of concern continue to be a topic of concern for health officials. Since testing for the variants began in February, the district has recorded 41 cases of COVID-19 involving one of the mutations. Meanwhile, the vaccination campaign in the region continues to roll out. People aged 50 and over are expected to be able to start registering for their vaccinations later today. Dr. Janet DeMille is the medical officer of health for the Thunder Bay district. She joins us this morning with her weekly look at the COVID-19 situation. Good morning.
Good morning, Mary Jean.
So as of yesterday, the Thunder Bay district had 45 active cases of COVID-19. We're seeing daily case counts in the single digits. What's your opinion of our current trend?
Well, I have to say I find it very reassuring. I think what we've shown, over the last couple of weeks especially, is that we can maintain low case numbers here. And the fact that we continue to do that and then also increasing our vaccination rate makes me fairly reassured and optimistic for the future. Always, though, a little bit nervous, a little bit given still what we're seeing in other parts of the province, and even how quickly things can change. And I follow what's going on with other health units, including our colleagues to the west of us and Northwestern Health Unit, who have seen a bit more of an increase.
Mm-hmm. Now, since March 22nd of this year, all COVID-19 positive specimens are being tested for the variants of concern. There have been 41 cases of variants of concerns in that time. How has this changed in the past week? Are we seeing more variants, fewer variants? Because I think that's people's big concern now.
Yeah, so I think a number of our samples are showing that they're variants of concern, but that's in many ways not surprising. We did have a couple of outbreaks that were related to the VOCs, and then as we sort of manage that and sometimes see spread individuals in their household, for example, those might be secondary cases, and of course when they're tested, they'll come back as the VOC as well. So I think that the number overall is low. The spread is controlled. And I do think, though, the VOCs are the main, type of COVID-19 that we have here, though, and I'm really just hoping it doesn't spread any further or crop up in different places. Because
the variants of concern have been found to be, spread more quickly, no?
Yes, they are known to be more infectious, and so they spread easily, and they spread quicker as well. So often, when you have an outbreak, you see sort of that the virus has spread in a particular setting much more easily than we used to see it. So it can result in more numbers of cases. We can see more spread in households and, certainly in workplaces as well.
Mm-hmm. Let's turn our attention to the vaccination campaign. Do you have a sense of what percentage of adults in the Thunder Bay district have been vaccinated?
So we report this sort of every Tuesday on our website, and in terms of those who are eligible for, when we look at sort of 16 and over or 18 and over, it was around 46% last weekend, and I think of the broader population, it is at 35%. So the whole population, including children.
How do you feel about that?
You know what? I'm really pleased with that, and these are numbers that go up every day, and we report it once a week, and I think the more people, the more that number goes up, the more people that are vaccinated or partially vaccinated with the first dose, that just provides more people are protected, their families are protected, workplaces are protected, and more broadly the community is protected, and the more we go with that number going up, the harder this virus is going to find it spreading in this area. So it'll harder, that will help limit spread in various places. So
now, as I mentioned in the introduction, my understanding is that people 50 and over could likely start signing up today. Is that still on track?
Yes, and actually we're going to see a fairly significant expansion in those in people who will be eligible for vaccination through the course of the month of May. Actually, every week there'll be more people who will be eligible. But today it will be individuals 50 and over. So right now we're focusing on 55 and some other groups, but it'll be 50 and over. Next week we might see it go down to 40 and over, and that will carry through. We're also going to see eligibility for essential workers who can't work from home. And under the Ontario plan, they've divided that into sort of Group 1 and Group 2. Well, Group 1 will also be eligible today. So we will see that. We are, over the course of May, we'll have a larger number of people will be eligible. And we'll be putting information out on our social media and our website as this moves forward. And we are actively working to open up appointment spots. So when somebody is eligible, they can book an appointment. It may be a couple of weeks down the road because there's still a balance between people being eligible and the supply that we actually have to be able to get to everybody.
Now, people 55 and older are the ones who went to pharmacies to get the AstraZeneca shot. Now some confusion with information from the National Advisory Committee on Immunization about weighing your options, about getting that vaccine versus waiting for a different type. What, if anything, can you say to help clarify the situation for people in this district or put people's minds at ease?
Yeah, I mean, it's, I just thank everybody who's gotten a vaccine, including those who got AstraZeneca, because, they have protected themselves and they're protecting their families, they're protecting their community as a part of that, and I think they should feel really reassured. I mean, COVID-19 can be nasty, and when we see it spread, we've seen that here, right? And we've seen hospitalizations, we've seen people pass away of COVID, and it's scary when that happens. And vaccination, we know, works. These are vaccines. The ones that are available are all effective against COVID-19. They reduce severe illness. They reduce the likelihood somebody will pass away of this, and we're overall reducing spread, which protects the community. With respect to AstraZeneca, there is a rare side effect that is fairly, not a side effect, there's a rare complication that is significant, and that is that VITT, the blood clotting issue that can appear anywhere up to 4 weeks post-vaccination. It's about 1 in 100,000, and we're not seeing sort of that kind of level of that with Pfizer. So there are differences between them, but it is an effective vaccine. And that's we do a lot of things on a daily basis in our regular lives that put us more at risk than that. And there's other issues. People are more at risk of having a blood clot due to COVID-19 or due to other issues than they are from AstraZeneca. And, I realize, and I think what NACI's saying is, people, should make an informed choice about this. But I think even in our area, just with our low counts, people are at far more risk due to COVID-19, and their families at far more risk due to COVID-19 than any vaccine.
Do you anticipate that at some point there may be a mixing of vaccines for people in that group who are getting vaccinated in pharmacies, that perhaps their second shot will be Pfizer or Moderna rather than AstraZeneca?
Well, you know what? I think there's a lot of interesting discussions happening about second doses for any of the vaccinations, and that's actually driven by a couple of things. I mean, one is actually supply. Right now, actually, people can't get an AstraZeneca shot here in Thunder Bay or in the district just because there's none available. And even some of the other vaccines, there's, differences in sort of the available supply. And so I think there's just look at, can people be immunized immunized with their second dose with a different type of vaccine. And one of the other advantages that may actually result in is that each vaccine works a little bit differently, and it triggers a bit of a different immune response when somebody's vaccinated. And the immune response is actually fairly complicated, and there's different components of it. And different types of vaccine, if given, might actually promote a broader kind of range of that immune response. So I think there's some interesting, research and looking at that could be done for any of that, and that includes AstraZeneca as well.
All right, let's turn to school. Everyone's asking, what is the likelihood that children in the Thunder Bay area could be back in the classroom for June?
So I really want schools to reopen for in-person learning. I know there's a lot of harms, and people are really challenged when that's not happening. And I'm very much hoping and anticipating that there will be a reopening for sure for June, especially if we maintain our numbers. It always comes down to numbers, but I think we're showing that we know what we're capable of that way. And certainly the vaccination numbers are going to help us. So those conversations are happening. Nothing I could really say more at this time, but I'm hoping, really hoping. I think it's very important that students get back to school.
Further to that, provincial stay-at-home order set to expire May 20. Is there a possibility that the province will switch to regional reopening at that point? Have you heard?
So I'm understanding that there will be sort of an approach to regional reopening, same that we've had before. I'm not sure what that looks like at this time or when that will happen. And, I think there will be a gradual reopening. So I wouldn't expect, for example, if we, that we would fully reopen right away, even if our case numbers will be low. But I really don't know when that will happen. And
is there talk that it would be the color-coded type situation again?
So I think they're still looking absolutely at those levels, and of course they were color-coded in the previous framework. I'm understanding that they're looking at that and trying to optimize it, looking at opportunities that the spring and summer season might allow that, for example, the winter season weren't really feasible, sort of pushing things outdoors as much as possible. So we might see some of that and some sort of framework that we would start maybe with more restrictions and then go through that. But I can't really speak much more to that at this time.
Listen, thank you. As always, I really appreciate you taking the time to get us up to date.
Thank you very much, Mary Jane.
Bye-bye.
Bye.
Dr. Janet DeMille is the Medical Officer of Health for the Thunder Bay District Health Unit.